again, viewers. Welcome to your very own favorite health program called Health Talk, where we talk about things that are health inclined and how to prevent yourselves and how to protect yourselves and how to, of course, understand more about health issues. And with me today, I have a health professional, and I would want him to introduce himself so as not to spoil his name. So, Doctor, please, could you introduce yourself?
Okay, good day, viewers. My name is Dr. Paul Emata. I'm a registrar from the Internal Medicine Department, ABU, Zaire.
Okay, so I could refer to you as Dr. Paul.
Yes.
Okay, Dr. Paul, welcome to Health Talk. You're welcome. And today we're going to talk about an issue which is prevalent and quite confusing to a lot of people. I'm talking about hepatitis. Now, a lot of people suffer it but do not understand how it comes to be and also how to prevent it. So I would want our health professional today to describe and explain to us what hepatitis is. So, doctor, could you do the honors?
Okay, thank you very much, sir. Hepatitis is simply defined as the inflammation of the liver.
Okay.
Yes. And the liver is a very vital organ in the body because of the various functions which it plays, in the sense that it helps to fight against infection.
Okay.
It has some metabolic functions as well, and also other various functions it plays. So once the liver is inflamed, those functions will not be able to, the body won't be able to carry out those functions once the liver is inflamed. And there are various things that can cause this inflammation of the liver. Typically, viral causes. And other causes also can be from drugs which we take in, from alcohol. It can even be from diseases such as autoimmune diseases, whereby the body goes to fight the cells of the liver. So once the liver is affected, they won't be able to carry out these functions well. So today we'll be talking about viral hepatitis.
Okay,
yes.
So I'm led to understand now that there are different types of hepatitis.
Yes.
And we're going to now focus on one particular one.
Yes.
Okay, all right, please.
So for the viral hepatitis, there are hepatotrophic and non-hepatotrophic viruses that affect the liver.
Okay.
For the non-hepatotrophic virus, that means they are not, the target is not primarily the liver. It can affect other organs in the body.
Okay.
Which, for example, the cytomegalovirus, the Epstein-Barr virus, and other viruses. For those that primarily affect the liver cell, which are the hepatotrophic viruses, there are basically 5 types.
Okay.
Yes. A, B, C, D, and E.
Okay.
Yes. So for the ones that are predominantly gotten from fecal-oral routes or through close contacts with people, which is virus A and E. And the other ones, these ones usually will cause acute infections.
Okay, so A and E, you contacted through personal
contacts, poor hygiene, eating infected food and drinks.
Okay.
Yes, usually more of an acute infection.
By acute, you mean more fatal?
No, not fatal, as in the duration.
Okay.
Yes.
All right, please continue.
Then for the chronic, the ones that cause chronic, that can lead to chronic infection and also complication and even death, is that is a B, C, and D. So predominantly we see that is B and C.
Okay.
So when we talk about viral hepatitis, what we predominantly see in the clinic are hepatitis B and C.
So A and E are rare? Is that what you're saying?
Yes, during epidemics, when there's an outbreak, during poor sanitation, you usually find these viruses happening. But the ones commonly in our clients is the hepatitis B and C, and which would also cause some complications, which I will talk about. Okay,
please continue.
Okay, so for the World Health Organization has said that viral hepatitis, in every 12 individual, 1 out of every 12 has viral hepatitis. So you see that it's very common
in the world.
And there are about up to 350 to 400 million people affected worldwide. So it's very important that we know about our status and we able to seek proper care to prevent any complications that would arise.
Okay.
Yes.
All right.
And also in Nigeria, studies have been done to determine the prevalence of this disease. A study done in 2015 showed that hepatitis B virus has a prevalence of 13.6%, while another study done by the Federal Ministry of Health showed that hepatitis C virus was up to 2.2%, which is quite a large amount.
Yes.
Look at the population of the country.
And of course the number of diseases out there, yes.
And there are many people who are not aware of their status, who go, because this disease, one thing about this disease is that it can run an asymptomatic course. That means the carrier would not know.
So just symptoms, it never escalates to...
It might never show.
Wow.
You might only know that you have it upon routine testing. You might not know that you have it, so it has an asymptomatic cause.
So hepatitis actually can lay dormant in somebody's system for a very
long time. You will not know that you have it until sometime maybe during it comes on when you start having symptoms. And the symptoms basically sometimes are non-specific. Okay. It can be anything. It can be a low-grade fever, abdominal pain, then yellowness of the eyes and the skin, which they call jaundice. Yes. Then the arthralgia, pain around the joints, and then passage of pills too.
Okay, and so that's actually symptomatic of other
things. So you might take it as malaria or something. Yes. So it's very important that we know our status.
Okay.
Know if one is positive, and there's also steps to go about monitoring this patient. Those are positive, because not everybody that get tested that you want to start treatment, because there are also some parameters that we would have to check for to see that the patient is due or right for treatment. Okay. Yes, and parameters like the liver function test, if it's deranged, or the abdominal ultrasound, we want to check the liver, because one of the complications is cirrhosis, which is shrinking of the liver. So we want to check, because in the liver there are different cells in the liver, and there can be some inflammatory formation like nodules in the liver. So we want to check if there's any changes. Yes, and also the viral load in this patient is also very important, because for example, for hepatitis B virus, there are various parameters, profile that we want to check. There's what we call the hepatitis B surface antigen. We want to check if it's present there. There's the E antigen, which reflects infectivity. Okay. Yes, how infective the virus will be. Then also the core antibodies. Also, all these profiles are things we check. We don't just diagnose a patient and immediately go to treat. No, you have to check all these parameters before we say, okay, this patient is due for treatment. And it's important that everybody knows that if these parameters are there, it's important we commence treatment. There should not be any delay for anything, because of the risk it portends, the risk of cirrhosis, as I earlier said, and also the risk of decompensation. That means when the liver starts failing, and also the ultimate risk or complication, which is cancer, liver cancer, because all these viruses, they are oncogenic virus. Okay. So they can lead to cancer. Yes. Oh, okay. So it's very important that we don't deny our patients of the benefit of treatment, because, for example, hepatitis C, when you take the medications, there's a possibility for cure of the virus, especially the hepatitis C virus. Okay,
when you say possibility,
yes,
are we saying now that hepatitis is relatively incurable?
For the hepatitis B virus, it's incurable. Wow. But for the hepatitis C, there's cure. Okay. Once you take, you're due for the treatment, and you take it religiously for at least 12 weeks. Okay. There's cure.
Okay.
That means they call it sustained viral response.
Okay.
When the viral load is suppressed and is beyond detection in the blood,
Okay.
we will say you've achieved cure, especially for hepatitis C virus.
Oh, but you can still have traces of it.
For the C, is cure.
Okay.
It's
Okay.
cure, but it doesn't mean that you cannot be reinfected.
Oh, okay. That's what I was.
Yes, you can also, because I will also go on to talk about the risk factors, because that is very important in this discourse.
Okay.
Because you see, these viruses, they can be gotten from our day-to-day interaction. Chiefly, the hepatitis B virus are gotten from body fluids, semen, and blood transfusion, even sweat. You can even get it from children playing together, and they can have this. Then also use of unsterilized sharp, some cultural practices that involve cutting, scarification marks, using of these instruments that are not sterilized. Can also, then even shaving. You go to the barber shop and the clippers are not well sterilized, they use it for an infected person and transfer on. Because the hepatitis B virus particularly is a very infectious virus. It is even more infectious than the HIV virus.
Wow.
And even hepatitis C virus. So it stays longer in even instruments that are not sterilized. Maybe use something, a needle or a razor blade, any sharp
anything
objects
that's come in contact with
blood,
with
blood, infected blood, yes. So there's a risk of transfer into this patient. And also, it can also be gotten from passed down from the mother to her child during delivery, yes, when they're exposed to blood. So that's why we say during antenatal care, all pregnant women should be screened for these viruses. Yes, the hepatitis B virus especially should be screened for it, because we want them that if we need to treat them, we will have to commence them on those that are positive and require treatment. Yes, we want to treat them. And also those that when you deliver, you'd want to also give the immunoglobulins to the children, babies, to be able to prevent the development of this disease. So it's very important that we note this. Then for the hepatitis C virus, basically from body fluids, especially blood, those who have who normally will take blood repeatedly, because there's some group of people like the sickle cell patients, people hemophilia, yes, they require repeated blood transfusion. That's why it's very important that our blood are screened, we have the safest quality of blood transfused, and precautions are taken to avoid transfusing bloods that are not well cross-matched, and also blood that are not well checked for these viruses. So it's very important, because most people have gotten this virus because of this
just innocently without
knowing. So it's important that we abide by this. And also abstinence is very important for those young people out there. It's good to stick to one partner, and you are sure of your status and the status of your partner. Then if you need to go outside, it's better you use protection, you use condoms to prevent the spread of the virus.
Thank you so much. That is quite a load of information in just a few minutes. I was just shocked at the, list of procedures to screen and, ascertain what kind of hepatitis one might have and all that. But I must say, I'm quite surprised. Why is it because based on what you have said, hepatitis seems to be as deadly, if not deadlier than the HIV virus, but it doesn't seem the public is enlightened that as well as they are about HIV. Why is that the case? Or correct me if I'm wrong, because I'm talking from a layman's point of view.
Sorry, let me correct you. It's the infectivity that is more for the hepatitis B virus. It's more infectious, I would say. Not that the HIV pandemic is a very serious thing. We should not trivialize that. So it's the infectivity, how infectious that I'm pointing at, like on sharps. Because normally these are things that we do day to day, shave our heads, cut our nails, and everything. So the infectiousness of the virus is more doesn't mean that the HIV virus is
not. Okay.
Yes.
So forgive me, I'm just talking from a layman's point of view on behalf of the viewers out there.
No problem.
Okay. Okay. Now, what are the preventive measures on ground, especially from a health professional and on behalf of the other health organizations out there? What preventive measures are being put in place, especially places where information is not as easily dissipated as they should be?
Okay. For the preventive measures, there are various. First of all, I talked about mother-to-child transmission. You know that for the antenatal care, all mothers are expected to go through screening at antenatal visits, because by then we'll be able to know, okay, who is positive, you understand, or who not, who would likely receive will have treatments, or the children, the babies, or not, the children will need immunoglobulins, because it also prevents the disease, you understand, once they are born. Because you see that most times the children, once they have that, about like 25% of babies or infants that are born can progress to have complications of cellular cancer, yes, in future, like from 30 years from. So it's very important that we start from that. Then also mass awareness, letting the people know about the disease, because not everybody know about this the hepatitis B or C virus. Also mass awareness, even from the Ministry of Health, and even from the down to the local government. Everyone has to know about this disease and ways to prevent them. The risk factors, I've said a whole lot of risk factors to avoid such practices, you understand, cultural practices that are harmful. Avoid indiscriminate use of sharps.
Oh yes. We even spoke about genital mutilation the week before, and its preventive measures. Okay.
Yes, those things are very important. And our blood, we should have clean blood in our hospitals. You understand? They should be tested and they should be screened. And also treatment, also very important, because we want everyone that are positive to receive the right treatment that at the due time, you understand. Then also to be able to prevent the complication, as I said, liver failure, because there are myriads of complications that can arise from this virus. So then also very importantly, vaccination.
I was going to ask if there are preventive vaccines out there.
Yes,
thank you.
Especially for the hepatitis B virus, there are vaccines that one can take. And then normally, apart from the immunization schedule that we have in Nigeria, it talks about children getting the hepatitis B virus immunizations, even from birth, 6 weeks, and 10 and 18 months. So all these are strategies put in place to help that in future or subsequently these children are immunized from this the viral infection. Then for those that are exposed to this virus, there are also immunoglobulins that they can also take and also be vaccinated as well, because the vaccine you can take them start at 0 at 1, 2 months and 6 months. Yes, the vaccine, and they are completed. Because once you are vaccinated, the risk of you having the virus is very low, or you are immune from that, from getting the virus. So especially hepatitis B. For the C, there's no vaccine available. Yes, there's no vaccine available. So all these precautions you want to take to prevent, and for those that are infected, there's still hope for cure for hepatitis C virus.
Well, let's talk about the hope then, because I mean, I won't lie, I'm already scared. Probably I have, probably I don't. You know, that sort of thing. I'm already thinking about, okay, how do I get tested and things like that. But okay, what hope is there for those people who might have hepatitis C?
Okay, first of all, those that are tested and there's we declared them positive. There are series of tests that one can undergo. Especially, it's important that you seek specialist care. And the hepatologist, there are those specialists involved in the care of
hepatitis.
Yes.
They are called hepatologists.
Yes, so it's very important that you seek those care, because as I said earlier, not everybody will be eligible for treatment. Yes, so they follow up these people to see, you want to check the viral load, because it's a virus infection, so you want to see the activity of the virus in the system. Is it increasing or is it just dormant? If it's dormant and the immune system is tolerating the virus, you might not need to do anything. But once you start seeing the viral copies that high or HPV DNA levels of more than 2,000 international units per million.
Okay, that's how you calculate it.
Calculate, because that's
the viruses in comparison to the blood.
Yes, so more than 2,000 per million, and you do a scan, which will show some inflammatory process going on. And also you do the liver function test, which will show that it's deranged more than 2 times the upper limit of normal. You'd want to start these patients on drugs, and these drugs, they are very effective drugs, especially a drug used for the hepatitis B virus, tenofovir drug. These are nucleoside analogs, and they help to there's less resistance once you use this drug, and it has been shown to achieve viral suppression. And these drugs is, especially for hepatitis B virus, is a drug you have to take for a long time. Yes,
I was going to ask, because I've heard that the medication process can be long, and if you are not religious in taking it, there could be a relapse. So please elaborate on that.
Yes, once you're not, you have to consistently be taking it, because if you're not taking it, the risk of resistance, that means the drug not working well in your system, or virological failure is more. So you have to religiously be taking it, the drugs, because as I said earlier, not everybody is eligible. But once you are deemed eligible, fit to start taking, you have to continuously take this drug, because the end, we don't want the liver to start shrinking. Well, the fibrotic process, but once it starts shrinking, it starts the stage for cancer. It's a precancerous lesions. Once you start having cirrhosis, and also all that risk that can happen, increased portal pressure, and risk of bleeding, because they can bleed easily, because it affects the virus affects the synthetic function of the liver, and also part of the synthetic function is those clotting factors. So we don't want it to get to the cirrhotic stage. So because from the cirrhotic stage, there's really little much that one can do about it, because that's a precancerous lesion. So the aim is to prevent the progression to cirrhosis. Yes, the aim is to prevent the progression, and also to suppress the virus, the virological suppression, to suppress the virus, and also to ensure that the level of the live a good life.
Yes.
To promote the well-being of our patients. So that's why we want to start treatment.
Okay, but you still did mention the time span now, just an average time span from someone who is undergoing treatment to when, because of course we know the body is different, people heal differently, but just a typical time frame between when the person starts medication and when he or she is certified.
Okay, for the hepatitis B virus, as I said, you have to take it in life. Once you start to
it's a lifelong medication, just like HIV.
Yes.
Wow. Okay, I didn't understand.
It's a chronic infection. So you have to, once you start the medication, you have to continue taking the medications. But for the hepatitis C virus, we talked about the cure. Definitely, there's virological suppression, and you want it deemed fit or cured. Yes. So that you take the drugs for 12 weeks straight without missing it.
No, I understand that.
Yes. So, but for the hepatitis B virus, you have to keep on taking these medications, and it's just.
It's one of those things you have to live with, like high blood pressure, diabetes. It's a regular, just to maintain your life.
Yes. Okay. Because we want suppression of the virus. Then when there's less than 20 copies, or 10 to 20 copies, we say that the virus is suppressed. Yes, and even if you will need to stop taking the medication, the specialist has to know about it, and they have to keep on monitoring as well.
Yes, definitely.
In the clinics. Okay, understand? You can't just say, okay, I'll stop, because the risk of resistance is much when you start.
All right. Well, thank you very, very much. It has been a very enthralling episode talking about hepatitis. I honestly did not know there were that many variations of hepatitis, but I'm sure the viewers out there, just like myself, have learned quite a lot as regarding hepatitis. And viewers, with that, we come to the end of this particular episode. And of course, on behalf of all the staff and everybody in charge of Health Talk, I am Ayuba Tete, your presenter, saying God bless, see you next time, and stay healthy.